Welcome to Every Mom is an Athlete, the podcast where we believe motherhood is inherently athletic. From lifting car seats to chasing toddlers, your daily life is a workout. I'm Dr. Karlie, pregnancy and postpartum expert, sports chiropractor, strength coach, and mom of three. This is your space for strength, recovery, and real talk in pregnancy, postpartum, and motherhood. Welcome, Strong Moms. You're in the right place. All right, Strong Moms, I am so happy to be back and introduce you to this wonderful lady that I just sort of started fangirling online. She has done so much research in the area of pregnancy and postpartum exercise and fitness. So I introduced to you Margie Davenport. And Margie, will you just tell us a little bit about yourself and what got you into doing all of this such important work?
So I'm a professor in the Faculty of Kinesiology, Sport and Recreation at the University of Alberta. So I'm an exercise physiologist by training, but a long time ago, more than 20 years ago, I was a national team athlete. And when I retired, I knew that sport and exercise had to be a big part of my life, but I had no idea what that would involve. So I went back to school, went to kinesiology, did my undergrad there, and got connected with a researcher who was doing work looking at exercise during pregnancy and the postpartum period. I had no interest in being pregnant at that particular point in my life. But when I started working with her, I really fell in love with the physiology and got to play with the babies. And so that's where it started. And I haven't looked back in the last 20 years.
Oh, that is amazing. I am so excited to just dive into all this research. So why don't you just kind of give us a rundown of how this kind of started, what you started with, and then, just we'll kind of get into some of it, some of your favorite stats and things that you want to share with people.
So my first sort of entry into research in pregnancy was actually looking at women who had gestational diabetes during their pregnancy and seeing if walking had any impact on their blood sugar levels. So that was sort of the first shot at looking at the clinical implications. And we found some pretty robust responses that when women were exercising after they ate a meal, that actually significantly reduced their blood glucose levels. Many of them actually didn't even go on to insulin, which is what we would normally see if you're, not exercising. So that was a pretty fun way to start. But as I sort of moved through my career as a former athlete, I actually became really involved in trying to better understand sort of the limits of exercise during pregnancy. So in Canada, we published the 2019 Canadian Guideline for Physical Activity Throughout Pregnancy. We saw these really profound benefits. So we saw about a 40% reduction in the odds of having pregnancy complications such as preeclampsia, gestational diabetes, gestational hypertension, without having an increased risk of having a miscarriage, a small baby, or a preterm or early baby. But what was really missing or sort of really noticeable at that time is that we had so little information more on those sort of long duration activities, the high intensity exercise, or even heavy weightlifting. And so a lot of the work that we've been doing since that time has been trying to help support not just, the general obstetric population, but also our moms who do want to do things that are typically not recommended during current guidance for exercise and pregnancy.
Wow. Okay. And I should say what we're going to do here is we are going to talk through pregnancy first. We're going to have Margie tell us all the research on pregnancy, and then we'll actually do a second episode with her just to keep these nice and digestible for you guys for postpartum. So we're really going to focus on pregnancy during this episode. So let's go back to your first kind of comment about gestational diabetes and walking. And then you said exercise. So was it just walking or was it exercise? And what does that look like? Like the amount that you found, give us some tangible things here for moms.
Yeah, so walking is actually exercise. It's funny. So we often think when we talk about exercise, we picture somebody going to gym, getting really sweaty, faces getting really red. But when we talk about exercise in the exercise physiology world, we talk about light intensity, moderate, and vigorous intensity physical activity. So certainly if you're going into a mall, sort of wandering past the stores and taking a look, that would be a light intensity activity. If you are doing a little bit of a brisker walk, so your heart rate and your breathing rate is increased slightly, that would be getting into the moderate intensity zone. And that was that exercise prescription that we gave to these women who had gestational diabetes. They were just going for a 20-minute walk after meals, and we found that their blood glucose levels were greatly improved. Now, certainly, there are many women that will need to, not just change their diet and their physical activity levels, but also go on to either metformin or insulin. And that is completely fine. But we do know now through some of the work that I've done with the World Health Organization that being physically active is very supportive, certainly for blood glucose level values, but also for your physical and your mental health as well.
Yes, I always am preaching that to people too. It's not just about the physical, right? It's also about the mental. So I know in the US, so our recommendations, right, for exercise during pregnancy and also for the average American, as far as just the exercise, not the weightlifting, is 150 minutes, right? So throughout the week, I usually tell my patients that's 5 times 30 minutes, right? A moderate level of intensity. And that's what I always try to preach is that, like you said, the slow walk through the mall doesn't count. The walking around the neighborhood, it just has to be brisk, right? Like you need to have your heart rate increased to basically get those benefits. Is that correct?
Yes, you're absolutely correct. But the interesting difference that we have between the US guidelines and the Canadian guidelines and most other guidelines around the world
Yeah,
is
that's what
that
I was going to ask what the Canadian ones are. I don't actually know. I'm so interested. Yes.
So in Canada, we recommend 150 minutes of moderate intensity physical activity spread over 3 or more days of the week, but certainly being active every day is encouraged. The difference that we have between Canada and the States is that in the States, there are recommended bouts of activity. So just as you said, you are typically encouraged to do 20 or 30 minutes at a time. Whereas Canada, the World Health Organization, and most other countries around the world, we don't recommend bouted activities anymore. We have this good evidence now that pretty much every minute counts. So if you go for a 1 minute brisk walk 150 times over the week, that completely counts.
Ah, okay.
The way of thinking about it is you can go for a 10-minute walk after lunch and dinner every single day. And that's one really more approachable way to be able to achieve that 150 minutes. But the other really important piece we don't talk about enough is that there are really profound benefits from activity levels well below the recommendations. So, for example, if you go for a 10 to 12-minute walk on every day of the week, you are going to have a 25% reduction in the odds of having preeclampsia. If you bump it up to 15 minutes a day, you're going to have a reduction in the risk of having preeclampsia, but also similar reduction in the risk of having gestational diabetes and gaining above recommended guidelines.
Yeah, that is actually super helpful and informative. I wasn't aware of that. That's really cool.
Just a quick second for my pregnant mamas now. During my third pregnancy at almost 40 years old, I had my easiest labor and fastest recovery, and I honestly credit that to doing my PregoCore program. PregoCore is a doctor-designed, by me, week-by-week plan that helps you stay strong, reduce pain, and prepare your body for birth, all in just 10 minutes a day. It works great on its own, or you can add it to your current workout regimen. If you want to train smarter through pregnancy and make recovery even smoother, head to the link below to check out PregoCore. And use the code ATHLETE for a special discount as a listener of Every Mom is an Athlete.
Now, let's talk about other types of exercise. You mentioned that a little bit earlier, helping pregnant women do things that aren't necessarily always seen as recommended or, and here I'm obviously a big proponent of that. Like I worked out probably too hard, to be honest with you, through my first 2 pregnancies, but I was very active through my third too. And I just really encourage women, to keep doing what they're doing. We talk about weightlifting, we talk about all these things. So can you elaborate a little bit on that?
So a lot of guidelines traditionally have suggested avoiding heavy weightlifting in pregnancy, Olympic lifting, and many other types of activities. And much of that's because almost all information and all research up until about 2019 was really based on walking. There might have been a couple of studies looking at swimming and cycling, but it's really only recently that we've started to look at heavier weightlifting during pregnancy. If you think about weightlifting in pregnancy, if you have a toddler at home, there's sort of this sort of idea in society you shouldn't lift more than 20 pounds during your pregnancy. But if you have a toddler, you're going to try and lift them up. They're easily over 20 pounds.
Yeah.
So it's just not a functional way to be able to go through pregnancy. So after the 2019 guideline, we started to really investigate this particular area. We started with a survey where we actually found that individuals who were lifting more than 80% of their one repetition max before they were pregnant, if they continued throughout their pregnancy, they had a 50% reduction in the odds of major pregnancy complications. We followed this up by doing direct in-person assessments of fetal health and well-being. So seeing if the fetal heart rate was maintained or umbilical blood flow. So the amount of blood flow going to the baby was maintained as well. And we found that up to 90% of 10 RM, which is equivalent to about 75% of maximal effort, it's really well tolerated by both mom and baby. And so we have an ongoing study right now looking at that top end, that 80% of maximal effort, and we'll hopefully have the results very soon, but quite encouraging
Yeah.
so far.
That is super interesting. And I could tell you, I wish I would have known you sooner. I could have sent a lot of participants your way because a lot of my patients are doing that. They're staying very fit and very active through their pregnancy. Now, what are maybe some of the myths? Could you dispel some of you already are, but could you dispel some of the other myths maybe that people hear around like why you shouldn't do these things during pregnancy or, in the past, why people might have said that?
Yeah. So one of the biggest ones that we often hear is don't exercise above 140 beats per
Yeah.
minute. That is, that's the bane of my existence,
Yeah.
really. That was put in place back in 1985 because they had very limited information about exercise and pregnancy altogether. It was actually removed from the American guidelines. I think it was about 3 or 4 years later. But even today in 2026, I got an email from an athlete just last week where they were saying, I went for a run and my heart rate was way over 140. I went to go see my OB and they told me that that was too high of a heart rate. But we have very conclusive evidence that you can go well past 140 beats per minute. And both mom and baby are doing very well. Now, the one thing we haven't talked about yet are contraindications to exercise in pregnancy. So all of the data that I have talked about so far is in women who don't have a medical reason where exercise would not be recommended. And so screening for that when you are pregnant is really, really important. Going and seeing your healthcare provider to get screened for contraindications, we found was actually a major barrier to women engaging in activity during pregnancy. Many would wait, weeks or months before they could actually get in. And so many would stop until they were able to go see their healthcare provider. Having found the incredible benefits, health benefits, and the safety of exercise within the scope of the current guidelines, we developed a self-completed tool called the Get Active questionnaire for pregnancy, which women fill out themselves and they are able to determine if they have to go speak to their healthcare provider for additional consultation before they begin exercising. But for the vast majority, they will screen into exercise and feel empowered to be physically active in their pregnancy.
Yeah, that's amazing. What I hear from a lot of people is they're worried about the baby, right? So, can you
Absolutely.
talk a little bit about the benefits, because I know there are, to the babies whose moms are performing this type of exercise during pregnancy?
hmm So we already talked a little bit earlier about potential risks. And so the evidence does not support risk to the baby. We don't see an increased risk of miscarriage. We don't see an increased risk of being born early or being born small. On the opposite end of the spectrum, what we do see is a reduction in the risk of baby born too big. So we call them macrosomic babies. They're large for their gestational age. It means that they're harder to deliver and they have a slightly increased risk for having different complications later on in life. There's sort of emerging data right now. I would still say that this is like in the research stage, but there is some data which starts to suggest that babies who are born from moms who are active during their pregnancy actually have stronger hearts. They have a little bit more brain activity. And there's some early data suggesting that they might be slightly ahead of the game in terms of their development as well. But again, that's really in the research realm. But overall, we do find that babies who are born to moms who are physically active during their pregnancy are born quite healthy.
Yes, thank you. I'm not just like setting you up for the questions that I know I want to hear the answers to, but I do love these answers. So, one thing I
Mm.
do want to ask you about is As far as I know what I see anecdotally, and I'm not obviously nearly in the research like you are, but just seeing, hundreds and thousands of patients in my 15 years here, what I notice is that women who stay active during their pregnancy also, generally speaking, of course,
Mhm.
have an easier time postpartum and recovering. So, is there any research around that? Can you enlighten us a little around what that looks like from the research side of things?
So I wouldn't say that the data that we have is as robust as you might expect. Part of that is because we really haven't done really strong, high quality studies to
Mhm.
specifically look at that. There is data coming, but unfortunately not published yet. So it's
Yeah.
a little hard to talk about. But part of the issue is that when you have labor and delivery right there in the middle, you might
Mhm.
almost mask some of those changes that or benefits that might actually happen when you are active during pregnancy in terms of your recovery. Even if it does seem a little bit slower, you might be farther ahead than you actually realize. And it's a bit hard
Mhm.
to disentangle that. The data that we do have, specifically in athletes, is that we see that most athletes will actually reduce their activity level throughout pregnancy, oftentimes because they are told that they're exercising too hard or too
Mhm.
much. But what we found is that if they continue to train during their pregnancy because they choose to, that they actually have a reduction, almost a half the risk of having an injury as they would if they reduce their activity levels overall. We see significant psychological health benefits, which is something that we don't talk about nearly enough.
Mm.
That if you're exercising during your pregnancy, that there is some persisting effect on your reduced risk of having depression postpartum as well. But certainly having that, big event of labor and delivery,
Yeah.
that can change absolutely everything. But you would expect that if you are a little bit fitter when you are pregnant, that you're going to recover faster in the postpartum period.
Yeah, I could see that would make research really hard, right? Because just the labor and delivery part is so
Mhm.
different literally for every single person, right? So it's hard you can't
Mhm.
standardize that, right? You can standardize like maybe even like the exercise during pregnancy and what you're doing postpartum, but like, man, that
Mhm.
whole birth thing, it turns out you can't really control it as much as we'd like, right?
Yes, absolutely.
Oh, okay. Margie, you are so full of information and so helpful. We are in a few minutes, we're going to transition and then we're going to pretend like, it's a whole new episode. But what else would you like to leave our listeners with as far as talking about pregnancy and fitness and exercise? Is there anything else we haven't touched on that you really think is important for people to know?
So I would say that there's a lot of fear-based messaging. When we talk about exercise in pregnancy, we often hear messages of caution or that you need to modify at a specific point. The data doesn't support that. The data suggests that exercise is very safe, it's quite beneficial for those who are able to. I think the other really important piece is that we talk about the benefits of exercise during pregnancy, but there's also a group of individuals where exercise is simply not recommended. And so it's not that they're missing out on those health benefits. It actually, if they were to be engaging in moderate to vigorous intensity physical activity, that would be more harmful for their health.
Mhm.
That being said, we do strongly encourage, contraindications or not, at least in Canada now, continued engagement in that light intensity activity. There's really strong evidence now that bed rest or complete activity restriction is not beneficial for either your physical health, baby's health, and certainly not for mental health.
Yeah, thank you for sharing that. You're right. I mean, we don't talk about the mental health aspect. And I really appreciate you saying that there is a small subsect of women, right, that really
Hmm.
shouldn't be doing that type of exercise. And we don't ever want to, really in anything we do, right? Like I think I feel safe saying we both like are very supportive of women and their pregnancies and their fitness. Yeah, it's important to remember that there is a certain subsect of people that's not in the cards and that's okay too. But for the general population, like you said, I think this is all just can be so helpful to have this like concrete evidence behind what so many of my listeners have been doing or wanting to do all along anyways. So
Hmm.
thank you so much for sharing all that.
My pleasure.
Yes. Will you please tell everyone where they can find you, all the things?
So my website is exerciseandpregnancy.ca, and you can find sort of the latest research that's coming out of my lab and around the world on Instagram at Dr. Margie Davenport.
Oh, thank you so much. I really appreciate you. And we'll have you back on to talk about postpartum.
Awesome.
Thanks for listening. Every Mom is an Athlete isn't just a podcast. It's a reminder that you're still the athlete you've always been. If this episode resonated with you, I'd so appreciate it if you'd share with a friend or leave a quick review. It helps more moms find the support and information they need. See you next time.